You have the floor.
Oh.
One June night, Roland Rolu waited for his wife to leave the house before taking an old hunting rifle and shooting it into his stomach. He then dialed 911 so his wife wouldn't find his body. According to the Edmond Journal, September 8, 2010, the Rolu family made an emotional plea to the courts to change the law so others wouldn't have to die, others in similar circumstances wouldn't have to die alone. This brings me to the question, should we legalize euthanasia? Yes. My purpose today is to persuade you that we should legalize euthanasia in the United States. First, we are going to discuss the reasons why we should legalize euthanasia. We're going to examine the laws in Oregon where euthanasia is legal, and we're going to discuss the benefits of euthanasia. So why should we legalize euthanasia? I think that we should legalize euthanasia to end the suffering of terminally ill patients with terminal illnesses, provide them autonomy, and give them the choice if they want to die with dignity or suffer through their illness. According to the American Cancer Society, last access March 1st, 2014, there will be approximately 1,665,000 newly diagnosed cases in the United States, and approximately 585,000 people will die of cancer. That's only cancer. There are other illnesses that cause people pain and suffering. Now that we have discussed the reasons why we should legalize euthanasia, let's examine some of the Oregon laws where euthanasia is legal in the United States. According to the public.health.org last accessed March 1st, 2014, the Oregon Death with Dignity Act, DWDA, enacted late 1997, allows adult terminally ill Oregonians to obtain prescriptions from their physicians for self-administered doses of medications. There are requirements. You have to be 18 years old, a resident of Oregon, and capable to communicate your health care decisions. And you also have to have an illness that you're going to die in 6 months or less. Also have to talk with a physician and a consulting physician to confirm the diagnosis and prognosis. According to the law, to the Oregon Health Division report in 2013, there have been 1,173 DWDA prescriptions written since 1997, and 752 people have died ingesting medications prescribed under the DWDA. I think that the physicians should even go further and into the, so that they can help the patient, take a load off the patients and help them with this, and the numbers would even go up higher. But that's another subject, so we're not going to go over that one today. Now this brings me to the benefits of euthanasia. The biggest benefit of euthanasia is so that terminally ill patients will not have to die and suffer from their illnesses. I'm a nurse, and even though we have pain medications and hospice in place, I have seen many cases where people and their families suffer for months and months before they die. There are also economic factors prolonging people's lives, and another big benefit is the families will not have to watch their loved ones suffer and do things that could possibly jeopardize themselves. According to the Huffington Post, February 12, 2014, a Pennsylvania judge threw out a case with a nurse who assisted her 93-year-old terminally ill father with euthanasia. Barbara Mancini gave her father, who's terminally ill, a bottle of morphine, and 4 days later he died. There was not enough evidence to support that Barbara had intended on euthanasia, but Barbara Mancini has been on unpaid leave of her nursing job for 1 year and has incurred over $100,000 in court costs and bills. Today we have discussed the reasons why we should legalize euthanasia, the laws in Oregon on euthanasia, and the benefits of If nothing is done to legalize euthanasia, people like Roland Rolu will be forced to take their own lives. People like Barbara Mancini will be forced to either watch their loved ones die or risk their own futures in helping their loved ones do, with euthanasia. So I would like everybody to vote for the legalization of euthanasia so that people can at least be given their own choice if they want to die with dignity or suffer with terminal illnesses. If this were you, would you like to at least be given the choice if you want to die with dignity, or would you like to be forced to suffer, see your loved one suffer, and put economic hardship on the industry?
Nice.